Well, you've probably seen the headlines. Our neighbors in Kansas are currently dealing with the largest tuberculosis outbreak in the nation since the 1950s.
You don't think of TB coming back like this. So you may be wondering if you're at risk, as Kansas is our neighbor to the north. News 4 Sydney Batslop joins us now with what health officials are saying about all this. Sydney?
Well, Kevin and Heather, in Kansas, there have been 67 active cases since January. The Oklahoma State Department of Health says there is no evidence that outbreak is directly affecting Oklahomans. However, health experts say it's still important to monitor the situation closely. As Kansas deals with the largest tuberculosis outbreak in the United States in decades, concerns are rising here in neighboring Oklahoma. But health officials say there is no reason to panic.
We're not seeing an increased number in Oklahoma right now, and the health risk is not really high, but we need to monitor the situation.
So far this year, the Oklahoma State Department of Health has reported 13 cases of tuberculosis. Health officials say that number aligns with what is typically seen. In 2024, the state saw 64 total cases.
TB is generally not the first thing we think about in the emergency room or in the clinic, but it does happen.
Tuberculosis is a bacterial infection that primarily affects the lungs. Some symptoms include a persistent cough, coughing up blood, fever, night sweats, and unexplained weight loss.
When we start to hear those symptoms, we really need to think about screening those patients for tuberculosis. We think of tuberculosis as this sort of infection of the past, but the fact is that it's still one of the #1 infectious killers of people in the world.
We can somewhat control it, but we probably can't eradicate it. And so it's something that we do have to think about.
Those with weakened immune systems or recent travelers to countries where TB is common could be at higher risk. Doctors say early detection is key, and while there's no vaccine in the U.S., there are effective treatments. County health departments offer free TB testing for high-risk individuals. Others can get tested through their healthcare provider.